Hello, everyone. Thank you for joining this presentation titled After the Pandemic, Understanding How Primary Care Teams Will Incorporate Learnings from the Pandemic to Support Their Communities and Patients. My name is Sandeep Gill, and I'm the Manager of Quality and Knowledge Translation at the Association of Family Health Teams of Ontario. For some context of the presentation today, the context of the study that will be discussed today is our reality today, the pandemic. Except this study was conducted during the first wave of the pandemic when COVID-19 had transformed primary care overnight, and we saw rapid implementation of virtual care and minimal guidance to primary care. The objective of the study is to understand the experiences of interprofessional primary care teams during the first wave of the COVID-19 pandemic. This study has two parts to it, as it was mixed methods. In the first part of the study, there was surveys that were sent out to the participants, and more information around the findings from the survey can be found in the poster presentation, which we'll link in the description box of this YouTube video. And then in the second arm, which is what this presentation will be focused on, it was a qualitative arm of the study where 191 AFTO member organizations were invited for a 30-minute semi-structured interview guided by an interview guide. AFTO members were invited through an email invitation, out of which 73 teams leaders had participated. From these 73 teams, 71 FITs, 1 NPLC, and 1 CHC participated in an interview. Interview questions encompassed team initiatives, community collaborations, and supports needed. Interviews were transcribed verbatim and are being analyzed using content analysis. Qualitative analysis through thematic analysis is underway using an in vivo. So I will be sharing the preliminary findings through this study so far. The 73 interviews were conducted by 4 trained students over the span of a month from the end of July to the end of August. From the preliminary results, we have 4 emerging themes. The first being virtual care, being the benefits and challenges. Second being the supporting vulnerable populations, whether it be seniors, children, mental health, and much more. Third being community partnerships, which were strengthened previous relationships or there was new ones created. And fourthly, there was team-based primary care, which is where there was a lot of discussion around collaboration within the community and opening up access to patients beyond their rosters. For the first theme in virtual care, we asked teams how they stepped up to support patients within their community and the vulnerable. Overwhelmingly, we heard stories around how teams transitioned to provide virtual care. Primary care teams have been providing virtual care for years. However, within 48 hours, we saw a massive transition to virtual care. Preliminary analysis demonstrated that the increased use of virtual care has shaped the future delivery of primary care, with an understanding of the benefits, including increased reach to patients and increased efficiencies, as well as challenges such as limited supports for providers and patients and barriers to access. In this image on the slide, you can see how teams adapted virtual care in different modalities. In this particular image, you can see them using social media, whether it be YouTube, Facebook Lives, or Instagram Lives. The second theme was supporting vulnerable populations. Teams identified the needs of the vulnerable in their community and reached out to partners to work together to address them. The needs of patients changed on a weekly basis, and so did the responses of teams. In this quote, you can see that wellness calls were conducted, and this was conducted by the majority of teams that participated in our research project. And the initiative was truly a team-based approach, as quids were querying a list of at-risk patients, and all providers, whether it be doctors, chiropodists, nurses, occupational therapists, anyone on the team, were calling patients to check in. We saw many providers adapt to this new role of system navigation, and dozens or even hundreds of calls were conducted. The third theme that has emerged is community partnerships. As you all know, Ontario Health teams were introduced to provide a new way of organizing and delivering care that is more connected to patients in communities. This collaboration with community partners, which was building before the pandemic, helped teams better work together. They embodied this concept of collaboration during the pandemic. Moving forward, many teams stated that they can see these relationships to be strengthened. Partnerships range from setting up assessment centers with public health, pharmacies, mental health partners, and much more. The fourth theme that has emerged is team-based primary care. We heard from teams how they opened many programs virtually to their communities and patients outside of their rosters. Teams have now definitely become well experienced in virtual care. With this, we heard from many that they see the future of primary care delivery to be partially virtual. The key messages so far from the preliminary analysis are that teams resoundingly stepped up to the challenge, focusing on supporting socially vulnerable patient groups. Underlying challenges for primary care became apparent, such as lack of virtual care supports, data gaps, the need for integration across healthcare sectors, and the importance of social determinants of health. The pandemic has highlighted the quality of care that teams deliver and reinforced that equitable access is essential. Understanding how interprofessional primary care teams responded can offer critical insights to inform providers with future pandemics and the future waves. I would like to take a second to thank all the participants who, in the midst of a pandemic, participated in the surveys and interviews of this project. I would also like to thank the research assistants who within a month had conducted these interviews and transcribed them. And a huge shout out to Dr. Catherine Donnelly and Dr. Rochelle Ashcroft for your support and guidance throughout this project and many more. And thank you for listening to this presentation. If you have any questions, please do feel free to reach out to me through my email that can be seen on the screen. Thank you. Have a great day.